What are the causes of preterm labor? Most patients are term or they deliver between 37 and 40 weeks of gestational age. This would be between the 9th and the 10th month in terms of weeks. Very rarely we do end up that patients deliver before this. This could be because they have medical issues complicating their pregnancy, such as diabetes or hypertension. It could also be because of twins or multiple fetuses, and sometimes it could also be that they rupture their membranes early, or they have an infection, or there is bleeding, and those are some of the rarer causes. Is it possible for us to predict preterm labor? We can predict preterm labor to a certain extent. Now, those patients who have multiple fetal pregnancies or twin pregnancies are prone for an early gestation because the uterus can accommodate a certain amount of space, and we have multiple babies. It does end up that they deliver slightly earlier. Similarly, when we have a patient with a medical complication, it could be that, say, diabetes or hypertension, if the blood pressure or diabetes is not under control, then we might end up delivering them early to prevent complications to the mother. So this would be a planned admission, and we could predict around what time it could happen. Now, very rarely what happens is that you do have patients in whom they've had a previous preterm labor, or say they have had surgeries on the uterus or on the cervix earlier, or we have patients who had bleeding during pregnancy. In these patients, what would happen is that we could predict preterm labor by doing a cervical length assessment, which would basically be that we'd measure the uterine cervix length between 16 to 24 weeks. In this case, when we do the cervical length assessment, we would see whether the cervical length is more than 2.5 centimeters or 25 millimeter. If the cervical length is lesser, or we feel that a serial assessment shows that the cervix is shortening, then you would say that this person is at high risk for a preterm labor, and we would take steps to prevent preterm labor. This could include giving her progesterone supplements, or it could involve putting in a prophylactic cervical encerclage.